Thank you, Madam Speaker. I rise to ask question 191, 2015 under my name. And the question is directed to the Minister for Health and Medical Services. Will the Minister answer the following? A, how many doctors and nurses, pharmacists and lab technologists have been recruited from the total of 10.8 million announced in the 2015 budget and provision for such recruitment in 2015? And B, the 2015 budget estimates Head 22, Program 2, Activity 1 states 4.8 million has been provisioned for the recruitment of 114 doctors in 2015. How many doctors have been recruited? Thank you, Madam Speaker.
Thank you. I give the floor to the Honourable Minister for Health and Medical Services.
Thank you, Madam Speaker. Thank you to the Honourable Biman Prasad for his question. The 10.8 million that was announced in the 2015 budget was for 441 new positions created in 2015 that included doctors, nurses, dental staff, laboratory technologists, medical imaging technologists, pharmacists, dietitians, physiotherapists, and people working in our stores. As we speak, we have recruited 126 doctors, 238 nurses, 10 laboratory technicians, 12 dietitians, 17 dentists, 4 medical imaging technologists. The total cost of this recruitment currently stands at 9.6 million. The second part of the question, in reference to 4.8 million, 4.8 million was for the recruitment of doctors and nurses into the urban hospitals. As we speak, 71 doctors have been recruited at a total cost of 2.1 million, and out of the nurses that were supposed to be recruited under that provision, 215 nurses have also been recruited to work into the urban hospitals. Thank you, Madam Speaker.
Thank you.
Supplementary question, Madam Speaker.
Supplementary question.
Can you, the Minister, brief this House with a shortage of doctors? How many nursing practitioners were given the acting appointment as medical officer in the various health centers, and also the professional advice as medical officers to sign those legal documents? Thank you, Madam Speaker.
Thank you, Honourable Minister.
Madam Speaker, it's a question that's asking for specific numbers. The thing that I can say is that nurse practitioners are nurse practitioners. They are not medical officers. So if they function, they would work as nurse practitioners. The exact numbers of nurse practitioners, I don't have that figure. I can provide it at a later date.
Thank you. The Honourable Salvatore Ndrondo.
Madam Speaker, I thank the Honourable Minister for his explanation. I'd just like to ask the question on this recruitment rate, which is quite high. What is the attrition rate like for these doctors and nurses, so that we don't have the same kind of recruitment again next year or the year after?
Thank you, Honourable Minister.
Once again, Madam Speaker, the question is asking for statistics, attrition rates. Those are details that I would have to source from the ministerial staff.
Thank you. Now you allowed only one supplementary question. I will now give the floor to the Honourable Semesa Karavaki.
Thank you, Madam Speaker. I thank the Honourable Minister for his answers. If the Honourable Minister can explain why these doctors, although they have been recruited, and the nurses and other medical officials, why they have not been provided with the overtime pay, because that's the reason why most of these officials are not doing overtime. Thank you, Madam Speaker.
Thank you, Honourable Minister.
Thank you, Madam Speaker. I didn't get the full extent of that question, but there was a hypothesis made there about what doctors are doing because overtime paid is or is not paid. The fact of the matter is, Madam Chair, overtime pay is a major issue in the hospitals. It is an issue that we have discussed. We are having discussions with our finance people and also with the Ministry of Finance to see how best we will be able to pay off a portion of the overtime as soon as possible. So those are things that we are looking at right now. Thank you, Madam Speaker.
Thank you. I give the floor to the Honorable Ratu Isoitikoda.
Thank you, Madam Speaker. The question I would like to raise is what sort of recruitment rate you are actually anticipating again for next year? Thank you.
Honorable Minister.
Thank you, Madam Speaker. A few years ago, Cabinet had agreed that for the next few years, we'll be improving our uptake of doctors, improving the new doctor positions. That has been going on for the past 2 years, and we intend to do this again for the next 2 years or so. We will be increasing the intake of doctors and nurses so we can get to the ratios that we need. Our target is ultimately to get to a ratio of 1 doctor per 1,000 head of population. That is something that we project to be able to achieve around 2017 or 2018, provided we can maintain the attrition of doctors. So those are the targets that have been put in place, and that has been a policy that has been put in place by Cabinet, and we have to feed that into the budgetary process. Thank you, Madam Speaker.